ابدي دعاء.
Assalamu alaikum. My seminar today is as continuation for central nervous system lecture. The three topic on my seminar about pituitary gland, limbic system, and midbrain. Pituitary gland, together with its connection to hypothalamus, act the main endocrine interface between the central nervous system and the rest of the body. The pituitary gland sits at the top, the base of the skull, in the concavity within the sphenoid bone called cella turcica. This is the saddle shape cella turcica with anterior glenoid at the anterior boundaries and posterior glenoid at the posterior boundaries. Anatomy of pituitary gland. The weight of a gland is about 500 milligram, and it is about 12 mm in the transverse diameter, 8 to 10 mm in the AB diameter, and 9 mm in the height. The normal size vary with the age and gender, being the largest one in the young and the active and the hormonal active state, such as puberty and pregnancy. Therefore, it is important to know the upper limit for every age in order to distinguish between pathological hypertrophy and physiological hypertrophy of a pituitary gland. The upper limit for the height of the pituitary gland is about 6 mm in the children, 8 mm in the male and postmenopausal female, 10 mm upper physiological hypertrophy in young female, 12 mm in pregnant and lactating female. The older adult more than 15 years show gradually decrease in the size. Division of pituitary gland. The pituitary is usually divided in practice into anterior and posterior parts, which actually refer to grouping of 4 subparts. The anterior pituitary, which is consist from pars distalis, pars tubularis, pars intermedia, and the posterior pituitary, which is consist of pars posterior or nervosa. Division of pituitary gland. The anterior pituitary or adenohypophysis is represented about 80% of the gland, and it is the part of the pituitary that is responsible for production of most of the pituitary hormone, with the except of the oxytocin and vasopressin, under the control of the hormone that is secreted in the hypothalamus and transmitted by portal circulation to the anterior pituitary. It is developed in the Radke's pouch in the rough or permeative mouth. The tumor arises in the epithelium of this pouch is called the craniopharyngioma. The posterior pituitary or neurohypophysis represented only 20% of the gland, and it is connected by infundibular stalk to the hypothalamus. The infundibular stalk consists of the nerve fiber that is cell located in the hypothalamus, and it transmitted the neurosecretory hormone, the neurosecretory hormone that is produced in the hypothalamus, which is include oxytocin and vasopressin, to the posterior pituitary gland. Therefore, the hormone produced by posterior part, it is not actually synthesis in the posterior part, but it is act as reservoir and reservoir for this hormone. This is diagram showing the subdivision of pituitary gland. This is the median eminence in the hypothalamus, from which extended the stalk, which is connected to posterior pituitary gland. And this is pars nervosa. And this is the anterior pituitary gland with its division. This is the pars tubularis, which is surrounded the infundibulum. And this is the largest part of the pituitary, the largest distalis. And this is the pars intermedia, which is closely related to the posterior part. Sometimes Radke's cleft cysts develop in this part and can determine it is on the imaging. This is diagram showing the production of the hormone by anterior pituitary gland under the control of the hormone that is produced in the hypothalamus and transmitted by the portal circulation to the anterior pituitary gland. This is diagram showing the hormone produced from the posterior pituitary gland. This is the cell in the hypothalamus which is responsible for the secretion of the hormone and transmitted by the infundibular stalk to posterior pituitary gland. This is hormone. It is responsible for posterior part of pituitary gland to appear as a bright spot on the MRI. And this is the hormone produced by pituitary gland, which is regulated most of the system of the body. This is T1 sagittal MRI image showing the pituitary gland, the posterior part, the anterior part, the posterior part which is appear as a bright spot. This is seen in 90% of the children, and this appearance is decreased with the age and connected to the infundibular stalk and the optic chiasm. Relation of a gland. Above the gland is diaphragm cilia, and above this, the supracellular cisterna with optic chiasm and circle of Willis. Below the body of sphenoid and sphenoid sinus. Laterally, cavernous sinus and its content, and more lateral to it, Michel's cave. This is diagram showing the relation to the cilia. This is the dura covering the cilia, the bony cilia, which is continuous with the diaphragm cilia, which should be transverse and accepted to be convex in physiological hypertrophy. Otherwise, convexity indicated there is pathology in the pituitary gland. The pituitary cilia is burst by the stalk. The diaphragm cilia is burst by the stalk and continuous with the dura that is covering the cavernous sinus on the lateral part of the cilia, which is contain the large and important structure, the internal carotid artery in its cavernous course, and the cranial nerve, the oculomotor, the trochlear, the abducens, the ophthalmic and maxillary division of trigeminal nerve. And more posterior lateral to the cavernous sinus will see the Michel's cave, which is CSF pouching containing the trigeminal ganglia. This is another diagram showing the supracellular structure. This is the optic chiasm, fundibular stalk in the supracellular cisterna, and the most important factor, the most important structure, the circle of Willis, and it is posterior and anterior part. This the supraglenoid portion of the internal carotid artery, which gives the posterior communicating artery, which is connected to the posterior cerebral artery to form the posterior part of the circle of Willis, and then terminated to form the terminal branch of it, the middle cerebellar artery and anterior cerebellar artery, which is connected to the other part by anterior communicating artery, and this is the anterior portion of the circle of Willis. This is coronal image, T2 coronal image demonstrating the cellular and supracellular structure. This is the pituitary gland, this is infundibular stalk, this is optic chiasm, and this is the supraglenoid and cavernous portion of internal carotid artery. And this is Michel's cave, which should be bilateral and symmetrical on image. Blood supply to pituitary gland. Anterior pituitary supplied by superior hypophyseal artery. Posterior pituitary supplied by superior hypophyseal artery, infundibular artery, and inferior hypophyseal artery. All of them give to the formation of portal circulation. Venous drainage is to cavernous and intercavernosal sinus. Imaging modality. Score radiograph, the lateral view. It is provide little information about the structure of the pituitary gland. CT scan, it is provide information about the bony structure of the pituitary gland. MRI based on the coronal and sagittal section, posterior pituitary appear as high signal on the enhanced T1, the bright spot of the brain. Gland enhanced strongly and uniformly. And this is the skull radiograph. This is the sella turcica, the polycella turcica with anterior glenoid at the anterior border, posterior glenoid at the posterior border, and which continuous with the glyphus, and the sphenoid sinus is seen posterior to it. This is a cross section of native and enhanced CT scan showing the cellular and supracellular region. This is T1 coronal image of MRI, demonstrated the cellular structure. This is the pituitary gland with the infundibular stalk, supracellular cisterna, with optic chiasm in supracellular cisterna, with the carotid artery in the cavernous sinus, and the sphenoid sinus posterior to it. This is T1 MRI sagittal image demonstrated the pituitary gland, normal pituitary gland. This is the enhanced T1 sagittal and coronal image. Pituitary gland is one of the structure of the brain that don't have blood-brain barrier. Therefore, it is enhanced normally and show homogeneous enhancement. This is the enhanced stalk, the enhanced and the enhanced gland. And it is also, this is the enhanced stalk and enhanced gland. One of the normal variation of the pituitary gland is empty cella. The normally is the pituitary gland, it is called the sella turcica. In the empty cella, the pituitary gland, it is when it is shrinking or non-visible, the CSF with the stalk will drop and fall the sella turcica. This situation occurs as a primary cause and seen as incidental finding, but this also occurs as a secondary cause for radiotherapy and surgery and with idiopathic intracranial hypertension. And this is appearance on the MRI image sagittal and coronal. Seen the stalk in the cella and the pituitary gland is not seen. This is two cases from Radiopedia, demonstrated the normal physiological hypertrophy of the pituitary gland. This is the first one for 30 years scale, demonstrated the gland it is enlarged with convexity of the diaphragm cella. On the bright spot, it is also seen. And this is for 35 years female in 2 weeks postpartum, also demonstrated the enlargement of the gland with convexity of the upper diaphragm. And this is also cases from Radiopedia demonstrated effect of the age on the pituitary gland. This is the case taken for 20 years female, and after 14 years it taken for the same patient. Here seen the gland, and after 14 years showing decrease in the size of the gland. And this is several MRI image for the common pathology occurred in the pituitary gland. This is the pituitary microadenoma, Ratkesi cleft cyst, and pituitary craniopharyngioma. Now talking about the second topic of my seminar, limbic system. Limbic system, it is a complex. نعم عمو.
انت على الايباد
ايه يا عمو على الايباد.
تقدرين تقلبي تسوي مو بالطول حتى الصورة تكبر.
تمام عمو. Limbic system. It is a complex group of interconnected brain structure and fiber, a tract located within and adjacent to the medial surface of the temporal lobe. Consists of cingulate gyrus, sublineal gyrus, parahippocampal gyri, and hippocampus dentated gyrus, fornix, indesium, ecclesium, medium, and lateral longitudinal stria. And this is diagram showing the structure of the limbic system. This is the cingulated gyrus, which is extended along the geno and the body of the corpus callosum and extended around the sublineal part of the corpus callosum as sublineal gyri, and then continuous as hippocampus and hippocampal gyri. Hippocampus, it is continuous with the fornix. The cingulate gyrus located on the medial surface of each cerebral hemisphere just superior to the corpus callosum. This is the cingulate gyrus. And inferior to it, sometimes seen the endensium crasium, which is a gray matter located on the corpus callosum. And this is the cingulate gyrus seen on the imaging. Hippocampus. Curved shape resembles seahorse. It is curved elevation in the floor of the inferior horn of the lateral ventricle. It consists of enlarged, rigid anterior end, has the appearance of a bow. It is the base hippocampi, and the alphus, which is a fine covering of white matter. It has strong role in the transition of memory from short memory to long-term memory. Damage to the hippocampus may result in the loss of memory. High-resolution MRI image of hippocampus are useful in the evaluation of patients with dementia seizure associated with hippocampus sclerosis. And this is diagram showing the hippocampus. The free end of hippocampus will give rise to the fornix, crura of the fornix, which is run on the upper surface of the thalami under the surface of the corpus callosum and join with the other parts of fornix to form the body, which is then divided to form the column, which is in mammillary body. And this is also a diagram. This is the hippocampus. This is the crura of the fornix. This is the body, and this is the column. Fornix, which represented efferent pathway between the hippocampus and the mammillary body, and consists, as mentioned, from the crura body and column, which is end in the mammillary body. The amygdala is seen here, located anterior to the hippocampus. And this is the appearance of the fornix on the sagittal MRI image. This is the fornix, the body of the fornix. This is the column, and this is the mammillary body. And this is also the cingulate gyrus, which is part of the limbic system. Radiological of the limbic lobe. MRI, fine-cut coronal MRI, perpendicular to the axis of the hippocampus, angled axial. Sagittal image along its long axis are used to image hippocampus, especially in the evaluation of epilepsy. Ultrasound examination of neonatal brain. The cingulate gyrus can be identified surrounding the corpus callosum. The body of the fornix can be seen below the septum pellucidum on the midline sagittal image. And this is sagittal T1 MRI. We'll see here T2 MRI. We'll see here the temporal horn of the lateral ventricle. In the floor of it, we'll see in the head of the hippocampus, and anterior will it will see in the amygdala. And this is zoom image of the sagittal MRI showing the hippocampus, the head of the hippocampus, body, and tail of the hippocampus, with parahippocampal gyri located posterior to it and amygdala anterior to it. This is sagittal image of transcranial ultrasound. We'll see the corpus callosum in genome and its body, cingulate gyrus superior to it, septum pellucidum, and anterior to it, below it, we'll see in the fornix. This is the third ventricle, fourth ventricle with midbrain structure, the midbrain bones, and medulla oblongata, cerebellum. Now, the third topic of my seminar is midbrain, which is part of brainstem. Therefore, I will talk shortly about the brainstem. The brainstem, it is connected the cerebral hemisphere with the spinal cord and extended from just above the tentorial hiatus to just below the foramen magnum. Most of the cranial nerve, with the exception of the optic and olfactory nerve, will originated from the brainstem, with being the midbrain give rise to the oculomotor and trochlear bones to the trigeminal abducens, facial, and vestibulocochlear, and the medulla oblongata will give rise to the glossopharyngeal, vagus, accessory, and hypoglossal nerve. Midbrain. It is short constricted portion about 80 to cm, which is connected the bone and cerebellum with the encephalon. It is traversed by narrow channel called cerebellar aqueduct filled with the CSF. It consists of First cerebellar peduncle located anteriorly and laterally. Internally, the cerebellar peduncles are further separated by the substantia nigra into cross cerebri, anterior and tegmentum posterior, ticta, rough or quadrigeminal blade, part of the midbrain posteriorly, to the aqueduct that houses four rounded prominences called the caliculi. The caliculi separated by the cruciform sulcus. There are two superior and two inferior caliculi. And this is diagram was showing the structure of the midbrain, the anterior structure of the midbrain. This is the cerebellar peduncle, which is transmitted the fiber from the internal capsule to the bones and separated from the cerebellar peduncle of the other part by interpeduncular fossa. The cerebellar peduncle is separated from the tegmentum by the substantia nigra. The tegmentum, it is contained two rounded midline structure is the radionuclei. And the posterior to the radionuclei and substantia nigra appear on the imaging as low signal because both of them contain ferritin. And this is the aqueduct of Sylvius, which is CSF duct connected the third ventricle to fourth ventricle, and surrounded by gray matter called the periaqueductal gray matter. And below to it, we'll see the quadrigeminal blade or superior and inferior caliculus. The oculomotor originated from the anterior part of the midbrain. And this is diagram showing the dorsal aspect. This is the superior caliculi, which is connected by superior brachium to the lateral geniculated body of the optic tract. And this is the inferior caliculi, which is connected by inferior brachium to the medial geniculated body of the auditory system. And this is the trochlear nerve, which is the only nerve of the cranial nerve that is originated from the posterior surface. This is also a diagram showing the superior caliculi, the aqueduct of Sylvius, and the tegmentum with the radionuclei. This is T2 MRI image showing the structure of the midbrain. This is the cerebellar peduncle, substantia nigra, and radionuclei. Both of them will appear as low signal intensity, and this is the periaqueductal gray matter, and this is superior calculi. The midbrain, it is surrounded by important CSF space. The interpeduncular cisterna, which is seen between the two cerebellar peduncle and contain the oculomotor and the posterior, the terminal division of basilar artery, the posterior cerebellar artery, which is run in the ambient cisterna, which is located lateral to the midbrain, in which also run the vein of Rosenthal and the trochlear nerve. And posterior to the quadrigeminal blade, the most important cisterna, the quadrigeminal cisterna, in which form the vein of Galen from the joining of two internal cerebellar vein with basal vein, and then join to the inferior sagittal sinus to form the straight sinus. Cranial nerve emerges as mentioned previously, the third nerve, oculomotor, and fourth nerve, trochlear, plus supply to the midbrain. Central branch of superior cerebellar artery from the basal artery. Posterior mesencephalic vein, which is drained toward the gray cerebellar vein. Radiological image. At the axial CT and the MRI, the midbrain is seen at the level of circle of Willis. The crura can be identified anteriorly and the calculi posteriorly. It is not always possible to identify the cerebellar aqueduct. On the contrast, enhanced CT, the posterior cerebellar artery or posterior mesencephalic vein may be seen passing around the midbrain. Ferritin deposition, as we mentioned previously, in the substantia nigra and radionuclei lead to their appearance as low signal intensity on the T1 and T2 weighted MRI image. This is axial section of CT scan demonstrated in the midbrain. And this is sagittal MRI demonstrated the midbrain, the part of the midbrain and part of the brainstem, the bones and medulla oblongata. And this is axial image of T2 MRI. This is the cerebellar peduncle, interpeduncular cisterna, and superior calculi with ambient cisterna laterally and the quadrigeminal cisterna posteriorly. The midbrain is connected to the cerebellum by superior cerebellar peduncles. And thank you for listening and attention.
عاشت ايدك دكتورة دعاء. Very nice presentation و very important subject هو بالحقيقة هذا، لأنه خلينا نقول الخفايا مال البرين والفاين ستراكشرز اللي مهمة بالبرين. اكو احد عنده سؤال الدكتورة دعاء سعد إضافة حتى إذا هاي نروح على الكويز؟ ماكو، إذا نروح على الكويز تفضلي.
Number 1.
نورة محمد.
نعم أستاذ.
Number 1. Number 1 نور. وين هذا السكشن نور بابا؟ ما هي نور؟ أحمد خليل.
نعم أستاذ.
Number 1.
It's coronal T1 MRI. Number 1 supracellular cistern. Right supracellular cistern.
Right supracellular cistern. Okay. عقيل. Number 2.
نعم أستاذ، هذا cerebral artery.
Number 2 cerebellar. الانتيرير cerebellar.
cerebral artery.
نروح على جازان. حمد.
لا نعم.
جازان. Number 3.
نعم أستاذ. optic chiasm.
الأوبتيك chiasm. Excellent. ليندا. Number 4 شوي سهل هذا.
نعم أستاذ. البيتويتري ستوك.
This is the stock. خنساء. Number 5.
نعم أستاذ. pituitary gland.
This is the pituitary gland. The last number 6 نروح على محمد مهدي.
عمي اليوم نايت.
العفو أستاذ، محمد مهدي راح لأن نايت.
أوكي. علا.
نعم
علا
أستاذ.
سريع. علا.
هذا left internal carotid artery in cavernous sinus.
Excellent. عاشتي. عندك بعد مو دعاء؟ دعاء تسمعوني؟ استاذ.
اي هاي دعاء راح تفصل.
اي استاذ محمد يكتب اذا عندها حتى. اي
Number 5 عمو.
عندك بعد دعاء بابا؟
بعد Number 5 عمو.
دكتورة حولي على السكشن الآخر.
تم.
عندي سكشن آخر؟
اي عمو.
يلا استاذ محمد.
بس 6 أرقام هنا عمو. Number 1.
اي نمبر 1 عمر.
نعم استاذ. انتر هيمسفيريك فيشر.
انتر هيمسفيريك فيشر. زين. نمبر 2 شيماء.
نعم أستاذ. right frontal lobe.
رايت فرونتال لوب. رقم 3 علي حسين مصطفى.
نعم استاذ. هذا الرايت سايلفيان فيشر.
رايت سايلفيان فيشر. زين. زهراء صباح.
نعم أستاذ. Number 4 cerebral peduncle of midbrain.
نعم. زيد. نمبر 5.
نعم أستاذ. الأكويدكت أوف سيلفيوس.
وآخر شيء مو آخر رقم 6.
اي عمو آخر رقم.
لارا نصير.
نعم دكتور. Great cerebral vein.
هي gray cerebral vein in the quadrigeminal cisterna.
نعم quadrigeminal system هذا.
مم.
اكو بعد له هاي
عاشتي
لا هذا عمو.